Is your T3 low and everything else looks good? This could mean that you have T3 syndrome. And if it is treated like a typical hypothyroid patient, it's not really going to do anything at all.
You're watching the Dr. Jake podcast.
Welcome back to the Dr. Jake podcast. I'm Dr. Jake Schmutz. I'm an integrative doctor and naturopathic physician. And in this podcast, I share with you how to heal your body down to the root causes without harmful drugs or surgeries. I'm here today with my co-host, Teresa Marie, to talk about low T3 syndrome versus hypothyroid, which is often misdiagnosed and misunderstood when it comes to thyroid conditions. Yeah, so let's talk about what T3 syndrome is. So what this is you're not able to convert your T4 into T3 effectively. So your thyroid hormone is what makes T4 that get released out of your thyroid. It goes into the bloodstream, and then it needs to be converted into T3. This happens throughout the body in various cells. And there's a lot of people that have T3 syndrome is when that T4 conversion doesn't happen to T3. And T3 is what's actually active on the cells. It's what's sending the message into the mitochondria and telling it to do what it's supposed to do inside your cells. So you could have a ton of TSH, you could have a ton of T4, but then if you're not converting the T4 to T3, you're going to have all the hypothyroid symptoms that go along with that. You know, the fatigue, the brain fog, the memory loss, the constipation, etc. And this gets misdiagnosed all the time. So let's say you go to a regular doctor and you get your thyroid checked and you have T3 syndrome. What is the regular doctor going to do? What they're going to do is they're going to order a TSH. They might order a total T4, sometimes a free T4. And then they're going to get those blood back and they're going to be like, hey, your TSH, your T4 looks fine. You don't have any hypothyroidism. So they aren't really making the diagnosis of the T3 syndrome because they never did check your T3 or your free T3. So you could be like, oh, I don't have hypothyroidism, but really you do because the T3 isn't getting into cells and stimulating the mitochondria effectively. You might look up online and be like, oh, I have all the hypothyroid symptoms, but my doctor says I'm all good because they aren't checking for this T3 syndrome. It's very rare to go to a regular doctor that they are actually looking at this. They think if the TSH is normal, everything's good. But that's really far from what's really going on with the thyroid. And they're really missing a lot of a diagnosis of T3 syndrome when they don't look at the T3. On occasion, you might have a doctor that actually does check the T3. So how do they actually treat this? The regular doctor is going to treat it exactly the same as if you have hyperthyroidism that's caused by low T4. They're going to see that low T3, but they really don't want to give you any T3 or Cytomel. I don't really know why, but they are going to give you levothyroxine or Synthroid. That's what they give you. They very rarely get T3. Some of them, and this is even more rare, some of them give you a glandular, like an armor thyroid that has T4 and T3. That's good. But most of the time, they're just going to give you to T4 and be like, hey, you're going to convert enough of that to the T3. It's all going to be good. But in reality, it doesn't work out that way. You don't get a lot of the results that you want from Synthroid because you're not getting that T3, which is actually doing stuff, right? So that's usually what happens if you go to a conventional doctor and they even do see your T3 is low. Let's talk about what causes other forms of hypothyroidism and what causes T3 syndrome. So other forms of hypothyroidism is the most common thing is you have damage to your thyroid gland for some reason. This could be caused by radiation exposure, caused by pesticide or herbicide exposure, low iodine, a lot of things causing your thyroid not to function so you don't make enough T4. So T3 syndrome is different. You make enough T4, your thyroid is working okay, but you don't convert that T4 into T3 effectively. And this is usually related to nutrient deficiencies, many times from nutrient deficiency of iron or B12 or selenium or zinc, maybe a little bit of vitamin C. These are some nutrients that are really important for you to be able to convert your T4 to T3 effectively. But also you could have just chronic conditions, like you could have a chronic inflammatory state like an autoimmune condition, or you could have various other chronic infections or heavy metal exposure, etc. These chronic inflammatory states could cause you not to convert your T4 to T3 very well also. And I see this a lot in my chronic disease patients that have various conditions. They many times do have a T4, T3 conversion issue, and we need to address that. Yeah, so let's say an individual comes into my office, they have brain fog, they have fatigue, they have some constipation, and I do a workup on, I'm like, okay, you have something going on with your thyroid. Let me see what's going on. So what I do is I ordered a very detailed thyroid workup. It's a TSH, a free T4, a free T3, a reverse T3, and autoimmune antibodies. This gives me a whole look at what's going on. So I'm actually able to see if you have this T3 syndrome, conversion syndrome, or you have it just low T4, your thyroid's not working well, etc. Through these laboratory tests, I'm able to see that. So let's say I do make the diagnosis that you have normal T4, but your T3 is really low. How do I go after that? First of all, as I want to do some follow-up testing, and many times I'm already doing that in the first place, but let's say I didn't. I do follow-up testing and I do nutrient profiles. Many times I'm going to do a B12 folic acid, a iron panel. Those are the most important ones to see, okay, maybe you have a nutrient deficiency that's causing this and we need to address that. And then I'm also going to be like, okay, what else is going on that could be causing this chronic inflammatory state that we just started before that could cause that T3 syndrome? Is I'm going to look, okay, do you have heavy metal exposure? Do you have anything going on with your gut? Maybe you have food allergies. Maybe you have small intestinal bacterial overgrowth. Let's take a look if you have any chronic infections like Epstein-Barr virus, cytomegalovirus. Let's see if you have any overburden of pesticides or herbicides or glyphosate, or on and on and on. These inflammatory states could cause this T3 syndrome. But when I'm treating these underlying causes, I many times prescribe a glandular thyroid, like a Armour thyroid, Nature thyroid, West thyroid, something like that as I'm treating them. Or if I see that as severe enough, I'm actually giving them T3 by itself, either Cytomel or a slow release T3, whatever I think is going to work best for that patient. So they actually start feeling well. Their cells actually are working. So they're actually able to get over the cause of what's going on. If it's just a nutrient deficiency, very easy. I don't prescribe a T3 to help them. But many times in my practice, these patients are really sick. They have a lot of things going on, and we need to go after all these causes. And they can't get over these causes. Their immune systems don't work well. Their cells don't work well. Their mitochondria doesn't work well if they're not able to get enough thyroid. So I always like to give them the T3 so they have their cells working appropriately. And then when we get these causes resolved, then we start weaning them off of the T3 or other thyroid medications that they're on. Yeah, so can someone be eating a very nutritious diet, eating great, and still have nutrient deficiencies? 100%, yeah. It could be that they're eating food that is depleted in the soils. That's common. But more commonly, yeah, they could have some gut inflammation that's causing them not be able to digest their food appropriately, and they don't get a good amount of iron or B12 or zinc or some of these other nutrients that we talked about. So could low-dose naltrexone help with T3 syndrome? Yes and no. It depends on what's going on. We're not going to need to use low dose naltrexone for someone that just has the nutrient deficiency. But low dose naltrexone is a great immunomodulator. So it helps modulate the inflammatory response. So, like I said, these chronic inflammatory conditions can cause the T3 syndrome. So I use it in that case all the time. And I'm also using low dose naltrexone all the time with people that have Hashimoto's or Graves' disease, which many times they have Hashimoto's disease. They also have poor conversion to T4 to T3 that's going on. They could have normal T4. They could not be converted to T3 appropriately. So yeah, low dose naltrexone could be really beneficial. It just depends on what's going on with the patient. So what is the number to tell you that if you are actually low in T3, like on your laboratory test? So if you are 2.1 or lower, you are low in T3. That's very low. But I even consider 2.5 or lower low in T3, and many times I'm prescribing based on that, if they fit the symptoms of hypothyroidism. Yeah, those numbers that I just talked about, I'm talking about free T3. I rarely order just total T3. It doesn't tell me a lot because what's going on with this total T3, there's a lot of protein bound to that. It's not actually released. And free T3 is actually released and available to the cells. So I always order free T3, and those numbers I just gave you are based on that. Want to find me or find out what's going on with your thyroid, visit my website, integrativemedica.com. Find my number there. Talk to my receptionist to set up a phone call with me or some of my other great doctors. We also have a tab that says book online. You could click on there and set up an appointment with us.